Hello, I'm Rochelle Carey in for Femi, and you're in the stream. Today, the COVID-19 Delta variant, it is spreading rapidly across the United States. After a brief lull, cases are hitting a 6-month high. For healthcare workers, the new surge in mostly younger unvaccinated patients, that has been very hard to take. Today, we talk to them about the challenges they face. And if you're joining us on YouTube, please post your comments, your questions. We will be reading them and we'll bring you into this conversation. So to set the stage for this conversation, I want you to listen to a healthcare worker who explains what it has been like for her, in the words of this one ER nurse.
Nurses, stitch this. What are you afraid of most about this oncoming wave?
Not a damn thing. What do I have left to be afraid of? When I worked ER, I had to literally accept I was probably going to die. I had to accept all these other people are going to die. Am I scared I'm going to be short-staffed? My current department is so short-staffed, management is pooping their pants. Am I going to have to work extra? I've been working extra for like 6 months. Am I going to lose friends and family? Losing friends and family was so 2020. Am I afraid I can't help people? People don't want to be helped. I'm literally working on my master's and having people who couldn't pass 6th grade science tell me I'm a moron. People who have never stepped foot working in healthcare tell me I have no idea what COVID is really like. I have nothing left. I can't cry anymore. I can't grieve anymore. It's empty. And I don't have it in me to fight. If people want to die, I'm not going to stop them. And I'm sure someone out there's like, maybe you shouldn't work in your job. Cool. I already resigned.
And I suspect she speaks for maybe hundreds or thousands of healthcare workers out there. So joining us to discuss what we just saw and a whole lot more, from Boston, Massachusetts, is psychiatrist Dr. Nicole Christian Brathwaite. From Shreveport, Louisiana, ICU nurse Felicia Croft. And from Tampa, Florida, Dr. Manal Ahsan, assistant professor of internal medicine and pediatrics, University of South Florida. Thank you all for joining me. I know that you all are busy, stressed out, and the little bit of time that you have, you're giving it to us for this conversation. So we appreciate it very much. Obviously, we need to talk about what we just saw from that ER nurse. So I'm going to go to the psychiatrist on the panel, Dr. Christian Brathwaite. And before we get to that, Doctor, I'm going to read something that you posted on Twitter, something I think our viewers need to see. You said, "I have tested positive for COVID. I tried to be diligent about masking, but I had moments where I let my guard down. Now I'm isolating in my office and I can hear my kids crying because they can't hug mommy. I feel like I had a bad sinus infection, praying for quick recovery and everyone stays negative." So first of all, how are you feeling?
Tired, very tired, but overall I'm okay. Fortunately, I'm vaccinated, so things could be much, much worse.
And talk to me about what it's like having to be away from your family.
Actually, that's harder than having COVID. Seeing my kids or hearing my kids cry outside the door or having them leave little notes for me. I have 2 boys, they're 5 and 7, and they're definitely mommy's boys. And so I think it's hurting me probably even more than it's hurting them, knowing that the next 10 days I won't be able to hug or kiss them. So it's definitely painful.
And you're confident that the fact that you're vaccinated has made this a lot less serious than it could be. I think that people need to hear you say that.
Oh, 100%, 100%. And my husband and I are caretakers for our parents who are also very ill. So as soon as we were eligible for a vaccine, we all got it. And because we just can't take the risk being caretakers and having young kids. And I know 100% things would be significantly worse if I weren't vaccinated.
So now I want to circle back to what we started off with when we were listening to that ER nurse who's clearly at her wit's end. Does she sound like some of the healthcare professionals you've been talking to? What did you see and hear from what we just played?
I mean, honestly, she sounds like most, if not all, healthcare workers that I support in treatment, and even those who I'm friends with. People are demoralized, they're exhausted, and many healthcare workers are experiencing PTSD-like symptoms.
I want to play something else now from our other panelist, Felicia Croft, the ICU nurse from Louisiana. Felicia, thank you so much for joining us. I want to play something that we have of you as well, and then circle back. Okay, just sit tight. It's okay.
The Delta wave that we're seeing now, people are younger and sicker. And we are intubating and losing people that are my age and younger. People with kids that are my kids' age that are never going to see their kids graduate. They're never going to meet their grandkids. I can't explain the feeling of defeat when you do everything, you pour everything into a patient and it's not enough. And then to know that they could have gotten vaccinated and it could have made a difference.
I know it can't be easy to reflect and see yourself in that moment. How often have you had moments like that?
They've really come and gone a lot through this whole period. But they've been coming a lot more frequently with this group of patients, just because these are people that I relate to more on a personal level. Because they're my age. So we've had people that I've graduated with or that graduated just a year or two ahead of me. People that my kids go to school with their kids. And it's just, some of them have been my coworkers that we've had in the hospital. And it's just made it very, very different. It's next level.
And let me ask you something. You brought up a really good point that I want to ask. Are you surprised, I don't know, frustrated? How would you describe how you feel finding out that there's so many healthcare workers that also are resistant to getting vaccinated? Does that surprise you?
Some of it, because some of them I know personally, and it does surprise me that they're so resistant and so very open about spreading some of the disinformation that a lot of people are seeing. Because some of the things I see some of my fellow healthcare workers posting are things that I've researched myself that I have found to not be true. And that's very difficult. And I feel like that puts us as healthcare workers in a very difficult situation, because we're not just fighting against a virus. It's almost like sometimes we're fighting against each other, and we're not going to get anywhere.
You talk about that fighting against each other. I want to bring in Dr. Aslan into this conversation now. It seemed like at the beginning of this pandemic that everybody was seeing healthcare workers as heroes, were buying you meals, sending meals to the hospital, doing all sorts of things. There seems to have been a definite pivot now. Does it feel like that there are some people that are against you now?
I wouldn't necessarily say against us, but I do think that, as was mentioned previously, the pandemic has shifted. I think when we first started this pandemic, I've been taking care of COVID-19 patients since the beginning of this in March, and I've taken care of patients from, my youngest patient was 9 days old, and the oldest was in their 90s. And I think that there has been a definite shift. I think you're right that at the beginning, people were clapping and banging on pots for healthcare workers. I think now we are seeing, it's not that people are fighting against us, but there's a lot more to navigate in terms of the misinformation out there.
So I'm going to ask you this too. Are you having to navigate politicians? And I'm not trying to drag you into politics, but we can't separate the two, because unfortunately this pandemic has been politicized. The state that you're in specifically, the governor has mandated against mask mandates. And there are school systems that are telling him, we don't care, we're going to do what we think is right. How does that make you feel as a healthcare worker? On any level, do you feel that it's sabotaging some of the work that you all are faced with?
I think it's frustrating. I think as a physician who we believe in science, we know how this virus has spread, and we know that masks work, that vaccines work. So to hear not just the general public, but especially our leaders kind of tout these messages not supporting that, it is frustrating. And it feels that a lot of, as was said previously, a lot of this could be preventable, especially here in Florida. It has become a very politically charged topic, masks in schools. But I really think that a lot of the local school boards around the state have taken it into their own hands. Like where I live in Hillsborough County, the counties have come up with plans to have an opt-out plan for masks. So parents actually have to physically opt their children out from wearing a mask in school. So that's a way to navigate around some of the legislation that is there in place.
And actually, I'm gonna let Governor Ron DeSantis speak for himself. Let's listen to this.
We believe this is a decision for the parent to make, just given the uncertainty about what it means, particularly for a lot of the young kids to be in that. And I think that's where the vast majority of the districts. I know we have, I think, two who are not providing the parents with the rights, but obviously we believe that the parent, rather than the government, should ultimately be able to make that decision.
Felicia, I'm glad. Felicia, I was coming to you. I promise you. You absolutely go for it. Go ahead.
So I fully believe in the right to choose. 100%. I think, we live in America and we are based off the right to choose. But I also can say with school-age children, a lot of parents will be dishonest. There are many, many parents that are amazing and that will, keep their kids home out of an overabundance of caution. And I think that's wonderful. But I also know we have a lot of parents that are not in a position financially or family support-wise to be able to do that. And we have a lot of parents that'll give their kids Tylenol and send them to school. And I feel like sending our children that are not able to be vaccinated yet to school without any form of protection is just asking for trouble.
The reason I was actually going to come to you is because the governor of your state, Felicia, actually did backtrack when he realized, you know what, we need to get a little tougher on masks. Governor DeSantis has not done that. The governor of Arkansas at least said that he felt like he had made a mistake. So how did it make you feel, Felicia, when you felt like, okay, maybe these leaders are realizing what's at stake, and some of them at least have enough courage to say, okay, I made a mistake?
I think that is huge. As a parent, as an official, I think everybody needs to be able to realize when they've made a mistake and own it. And I fully support our government officials. I'm a devout Christian, and the Lord tells me to submit to the governing authorities, and I am going to respect their decisions and their choices. But I have so much more respect for somebody that can come back and say, okay, maybe we need to take a step back.
Dr. Christian Brathwaite, I saw you nodding your head. Go ahead.
Yes, and I think it's important to separate individual choice from public health. When we're thinking about safety, it's annoying when we're going into the airport and we have to take off our shoes and we have to do bag searches, but we recognize as a nation after 9/11, that was for the safety of our country. Wearing masks and vaccinating is the same thing. This is for the safety of our country and the safety of our children. And so when we're thinking about public health, we really need to separate what's necessary and what's helpful for the greater good. And this is very different. And I think people are making, government officials, individuals, they're making a big mistake when we're thinking about mental health of children and thinking that masking is more dangerous than COVID. And we still don't even know the full long-term effects of the neuropsychological, the mental health, and the physical effects of long-term COVID infection.
Doctor, how are you helping? Dr. Austin, go ahead. Go ahead.
I wanted to jump in on that. Absolutely, 100% agree. I think, this motto of my body, my mask has been thrown around. And I think that's really dangerous when you think about that in regards to public health. We have seatbelt laws. We have no indoor smoking laws. We have, like you said, airport checks. We have so many things in place to protect public health. And this is a very similar situation. It's not just about individual choice at this point. As a pediatrician, one of the frustrations prior to all of this was, childhood vaccinations and the anti-vaxxer movement. And so as a pediatrician, I've been having this discussion for years with parents about the importance of vaccines. And, we don't see people with polio anymore. We don't see people with tetanus or pertussis because we have vaccines that work and have saved lives. We don't see neonatal meningitis to the extent that we did previously. Vaccines work. And, this is an intersection of individual choice and public health is, I think, where a lot of the argument comes from and where the waters become muddy for some people.
When you talk about vaccine, no, go ahead. Go ahead, Felicia. No, it's fine.
I think also we have gotten into a mindset as a nation of, this is about me and this is about my body and this is about how I feel about what should be happening in my body and what should go into my body. But the thing is, you're putting something out of your body that's affecting other people. So that's like, if you have the flu, you stay home. If somebody has smallpox, that's something that was eradicated. And now with the anti-vax movement, we're starting to see some cases pop up here and there. And this is something that can hurt other people. I have a 10-year-old son that's not eligible to vaccinate, and he has asthma. And He's going to school with a mask, whether it's mandated or not, because it's to help protect others, even though those other people may not be protecting him.
So let me put some numbers out there. So when we're talking about vaccines, so far about 194 million Americans have gotten at least one dose. That sounds great. Flip side, though, 90 million eligible Americans remain unvaccinated. So that's where, you want to know where that gets us? That gets us in the last 2 weeks. We have 1.5 million new cases and 7,000 deaths in the past 2 weeks. We are absolutely going backwards. Dr. Christian Brathwaite, how do you help your clients who see this and feel like, how in the world can I possibly be here again? I know some of them want to quit. Some of them have quit. What do you tell them?
I mean, honestly, it's a challenge in healthcare, and I'm sure that the other panelists can speak to this. We're taught to put ourselves second. We're taught to deprioritize our personal and mental health and prioritize our colleagues and our patients. And I understand that. But at this point, many healthcare workers are saying, enough of that. I am not putting myself second. My family matters. I remember, in the beginning of the pandemic, many physicians at that point were making wills and were talking to other family members about who would care for their children if they died, because the fear of walking into the hospital and dying was a very real reality for most frontline workers. And now, as a psychiatrist, I'm a child and adult psychiatrist, so I see the physicians and the healthcare workers, and I also see their children. And that fear is coming back, that anticipatory anxiety before they walk into work, the nausea, the headache, the physical symptoms, all of that is coming back because of the profound helplessness that comes with treating COVID. And again, we need to recognize that the prevention is so much more effective than the treatment. We still haven't made significant gains in saving people once they're intubated with COVID. And a lot of our physicians and healthcare workers are just saying, I don't know if I can continue to put my mind and my body on the line for this again.
I know some people are wondering, how are we here again when there's so many people that are vaccinated? It's because, by and large, the unvaccinated people are what's driving this, and it's what's caused the Delta variant. I'm actually going to play something from a doctor at LSU, and then I want you to pick up on the other side of this, Dr. Aslan, because I want to make sure I'm understanding her correctly. Okay, so let's listen.
Okay.
Everybody thinks it's not going to be me. I'm really healthy. It's just not going to be me. Unfortunately, the Delta variant has proved us wrong. This year's virus holds on more tightly, infects you more deeply, and is making young people sick. This Delta variant is going to affect us all very differently. We all need protection for ourselves because more of our age group will become severely ill. And most importantly, because when you get vaccinated, you spread it less. And when you spread it less, you end the surge.
So, Dr. Aslan, this variant or these variants are happening because it keeps mutating because people are not vaccinated. Is that right, or am I oversimplifying it?
No, you're stating it correctly. As a virus transmits from one person to another, there's an opportunity for it to mutate. And that's what we're seeing with this Delta variant. It's, some mutations that have caused it to be more contagious and impact younger people differently. I think the physician in the video said it very nicely that, and I've been saying this from the beginning, that we can't predict as healthcare providers who is going to get really sick from this virus. We can guess based on your comorbidities, but I can't tell you why a 35-year-old ends up on a ventilator and a 90-year-old does not. Those are genetic variations, biochemical variations that, maybe studies in 5 years, 10 years we will find out. But right now I can't. So the safest and surest way for us to protect ourselves is to get vaccinated. And it's really frustrating, I think, as Dr. Brathwaite mentioned earlier, we are feeling it as healthcare providers on the front lines right now. The frustration of, seeing young people getting intubated, getting very close to intubation, having code talks, which is, would you like to be resuscitated? Would you like to be intubated, with younger and younger families, because families cannot visit COVID units because patients are contagious. We are feeling that frustration right now that this could have been preventable. And I think it's really causing on top of the burnout that we're feeling from working longer hours and, more shifts and all of that, we're feeling a sense of, it's difficult. It's a mixed bag of emotions.
Felicia, who do you have to, this is a personal question, but who do you have to talk to when you have really bad days? It's obvious you're a woman of faith, but do you actually have somebody you're able to talk to help you deal with this?
I do. My husband is wonderful. I'm very, very blessed. He is a paramedic, so he is also medical. And so he sees the care from outside the hospital to me, and then I pick up where he leaves off, kind of.
Yeah.
But he is somebody that I can really just share, when I'm just overwhelmed and I don't understand why people just can't get it.
Yeah.
Or, why people don't want to really know the truth. And he can really just he just listens. He doesn't try to fix it. He doesn't try to have the right words. He just lets me get it all out and then go take my shower. And then I come back and it's all better.
Let me ask you this, though. If we keep in this pattern for, I don't know how long, where we go up and down and up and down, do you want to continue to be an ICU nurse? Do you ever think, maybe I don't know how long I can do this? Because it feels like the world is asking a lot of all three of you.
I love my job. I love working in the ICU. I love the people that I work with. We have a really great team. We help each other a lot, and that makes the hard days a little bit easier, and we get to celebrate our victories together. But it is difficult, and, it's just every day is a new day, and I try to just remind myself. I have a little devotional that I listen to by a guy named Paul White every morning on my way to work, and that just kind of helps clear my head and remind me that God's mercies are new every day, and that today is going to be different. It might not be better, but it's going to be different, and it's going to be new opportunities. And I just use the ICU as my mission field, and I will be there as long as the Lord has me there. Really, the only thing right now that would make me change would be the hours. I have a daughter that just started high school today.
Congratulations.
And my kids are, they're very, very active, and it's hard with me working 12-hour shifts and my husband working 24-hour shifts for us to be able to be there for all the things that we need to be there for. But it wouldn't be because of what we're seeing now that would make me leave. But It does make me tired.
Okay. Dr. Nicole, if I can call you that, we're talking about what healthcare workers are going through. You touched on something, and we're almost out of time. I should have brought this up sooner, but I am very curious. What might this do in the long run to kids being in and out of school? It just feels also negative right now. So what should people be on the lookout for when it comes to kids?
Sure. So, I think, and we've probably all seen this in adults as well, stress leads us to regress. And I would not be surprised if we're seeing ourselves regress a little bit over these last couple of years, but certainly our children. And with this new school year, everyone was hoping we would return to more normalcy. I'm not sure what the school year will look like. So kids really strive with structure, consistency, things that are predictable, and providing as much of that structure and support and love as possible. Even if everything in the outside world is changing,
Sure.
You still have dinner at the same time. Bedtime is still at the same time. At least still having certain very predictable things within their schedule and their day helps to reduce some of that stress. But we really should not be surprised if we start to see kids regress to behaviors that we were seeing last year.
I think that structure might be good for some adults as well. Thank you all for the conversation. Thank you for everything you do. Dr. Nicole, please take care of yourself. I know this is going to be a hard few days for you, but thank you all very much. Appreciate it. I'm Dr. Nicole Christian Brathwaite, Felicia Croft, and Dr. Manal Asen. And thank you for joining us for today's show. That's all of our time for now. See you again soon.